is a program, a master's program at Georgetown, a 1-year program that we'll put the link to in the chat in case anybody is interested in looking at what we're doing, looking at past seminars or finding out what the admissions cycle is in the program, etc. So I'm anticipating we'll have a broad audience of both students and outside people today. The Health and the Public Interest program emphasizes the non-clinical things that affect our health and healthcare, specifically social determinants, economic marketing determinants, legal and socio-political, etc. So lots of different influences to health, of which it's estimated that only 30% really are clinical by those who think about these things. So as we do the seminar today, we're going to have a formal introduction by Ibo Liu, who's one of the Health and the Public Interest seminar students. And then Dr. Sorrell will do her formal presentation. It'll last around 45 minutes. She's going to be available for question and answer and discussion after that, first from students of the seminar, and then we'll broaden it to outside participants. We have a hard stop at 1:45. So with that, welcome, Dr. Sorrell and Ibo, please go ahead.
Thank you. And as we thank you for coming. As from the introduction, we know that Dr. Sorrell is the senior scholar at the Johns Hopkins Center for the Health Security and associate professor at Johns Hopkins Bloomberg School of Public Health. And with a decade of experience in the virology and government, she has contributed significantly to global health security as both a practitioner and academic. Her research combined on the basic science, biosafety, and health system strengthening to address a range of infectious disease threats from novel and emerging to re-emerging. And before joining the Johns Hopkins, Dr. Sorrell held positions at Georgetown University and George Washington University, where her research centered on Avian to human transmission in the Influenza A viruses. Dr. Sorrell holds degree in animal science and virology for the Cornell University and the University of Maryland, and is an alumna of the LB Fellowship and the Council for the Foreign Relationship. So everyone, let's welcome Dr. Sorrell. Thank you.
Thank you so much for that fantastic introduction. And it's a pleasure to be back at the Happy Seminar and be back with the Georgetown community, albeit on Zoom. And so I'll just get right into my talk today. And I'm flexible if people have comments or questions as we go through the slides and you would like to have a discussion point, please feel free to do so. That this is absolutely an exchange versus just being death by PowerPoint. So please feel free to join in at any time. But today I really want to just talk about some important aspects that have really been going on for a number of years, but have just really started to hit mainstream media and thinking about avian influenza and the aspects of public health preparedness and response, particularly as we are still coping with COVID and a number of other emerging disease issues. So it's kind of just as a starting point, if we think about H5N1, specifically thinking about highly pathogenic H5N1, which means it's a systemic infection, not just an upper or lower respiratory tract infection, but again, impacting a number of organs and has that viremic spread. Since really October of 21, there has been an unprecedented number of outbreaks that have been reported across a number of species, primarily avian species, and that has led to severe die-offs in specific species, impacted ecology, impacted waterfowl migration, and then has onward spread to various mammalian hosts in different regions of the globe. This is not impacting one region. It's really a global issue right now. In addition to all of this concern from an avian health perspective, right, there's been a huge impact on global food security, on livelihoods, biodiversity, and wildlife ecology. And I would caveat that would include both sea and land mammals. I'm sure many of you are quite aware of the skyrocket price in eggs and various poultry products. And I don't think that has been as effectively tied to the issue that we're facing right now with this spread of H5N1. I would note right off the bat that my professional opinion is that the primary risk still stands with avian species. There are a rising number of cases that have been reported in a number of animal species, and that's highlighting the risk that this virus has for spillover, that the risk that this virus has to adapt in mammalian hosts. And I would note that there's been a lot of conversation about, are there intermediate hosts? So essentially a mammalian host that would be an intermediary between the avian species and humans that would allow for this virus to mutate, adapt, to become more efficient, and essentially establish itself as a human influenza virus. That is a concern, but again, flagging that from where we stand currently, I think the primary risk still stands with avian species. So a little background on HiPath AI, specifically looking at H5N1. It was originally identified in 1996. So this particular virus strain has been around for a number of years. There have been multiple waves of transmission, and this is transmission within avian hosts, starting really in 2006, that affected a number of countries and regions. And there have been reported waves, I would say, of these regional outbreaks in 2016, 2017, and before this current event, most recently starting in 2021. And there have been over 50 countries and territories that have been impacted by that. HiPath H5N1 has been responsible for either the death or culling in response to infection of more than 316 million poultry worldwide. And those peaks of either die-offs or culling are associated with some of the higher waves of transmission. There have been a number of spillover events. So we're talking about a direct infection of H5N1 or another avian influenza virus to a human host. They have not resulted in onward transmission, so we cap it at that spillover event. H5N1 has over 870 cases reported, and it has quite a high case fatality rate of there's a range depending on the type of H5N1, but in general, it's about a 50% case fatality rate. Some of you may have heard of H7N9. There are about 1,500 cases that have been reported. And again, a high case fatality rate, considering that we've had such a strong response to COVID with a 1 to 2% case fatality rate, depending again on the wave and the resources that we had to respond to COVID. H5N6, smaller case count of about 80 cases, again, about 37% case fatality rate. And then H9N2, which is again about 80 cases, and this is a much lower case fatality rate. The reason I wanted to include H9N2, it is a low path strain, but it has characteristics that look quite human-like in the way that it binds to host cells and the way that it can transmit. And so this, I think, is a one that does not get as much press coverage in terms of risk factor because it is not as fatal, but it has shown to adapt more easily to mammalian hosts. And then we've had sporadic cases of H3N8, H7N4, H7N7, and H10N3. Essentially, what I just want to get across here is H5N1 is not the only avian influenza virus that has caused spillover events, but it is the one that is consistently creating high case fatality, and in the last few years really expanded its range, both from impact in avian species and isolation and death in a number of mammalian hosts. So I think important to note is that all influenza viruses start in an avian species. So wild aquatic birds are the reservoir host for influenza A viruses. And so really one of the mechanisms that the virus has taken advantage of to think about both host evolution and host expansion is through the migratory process that these wild aquatic birds follow. And this is just one of many different schematics that represent the different types of migratory pathways that these birds take. And I think really what's important to note here is that they cross over, right? So you could have a stopover ground where you actually have 2 or 3 flyways that are interacting. You then have those species interacting, and they are congregating potentially in densely populated areas, potentially near poultry farms or backyard flocks, and have the opportunity then to potentially expose local and domestic species, as well as wild avian species to the pathogens that they essentially leave behind. This is a very busy slide, but essentially what I just want to highlight here is the host pathogen interactions of influenza. So we talk about H5N1, that is one of many combinations of what we call subtypes for influenza. So there are 2 surface proteins for the virus, the hemagglutinin and the neuraminidase. We reference them as HA and NA for short. There are 18 known hemagglutinins and 11 known neuraminadases. So essentially you could have any combination of 1 to 18 HA and 1 to 11 NA to create an influenza strain. We have to date isolated H1 to H16 and N1 to N9 in that wild aquatic population. So they are real reservoir host for the fantastic number of combinations of influenza viruses that exist. H17 and H18 have been isolated in bats. As someone in the public health space, I think most of us would say, "Oh, that doesn't sound great." Bats tend to be a reservoir host and a spillover risk. What has been collected so far from a research perspective, these 2 subtypes are very low level risk and don't seem to play a major role in both expansion host range to other avian or mammalian hosts, and particularly not a risk factor for spillover to humans. So it's really the wild birds that play that role, and they have mechanisms to, again, spread to domestic poultry, to other mammals, and through that kind of intermediate route, provide opportunities for the virus to adapt, mutate, and become potentially human-adapted, human-established viruses. To date, we've had 3 subtypes that have crossed over and established themselves efficiently as human influenza viruses: H1N1, H3N2. Those are the 2 that we develop annual vaccines for a seasonal strain, and then H2N2, which created a pandemic in 1957 and really hasn't circulated since the late 60s, early 70s. In terms of documented spillover, right, I mentioned the idea that you really could have that spillover event from the wild aquatic birds directly to other poultry, domestic poultry. You could have it to other mammalian hosts. Most often, those are the 2 kind of conduits to then human infection. But there's a lot of consideration for influenza when we think about interspecies transmission. We have to think about the host range, transmissibility, virulence, right? If you're too virulent of a virus, you're not going to have the opportunity to really replicate and spread if you kill your host too quickly. The role of intermediate hosts in adaptation and evolution, the tropism, where the virus replicates, how it's shed. Avian influenza viruses replicate typically in the gut of wild aquatic birds and domestic poultry. So it's a fecal oral transmission versus what we are accustomed to from a human transmissible route of upper and lower respiratory. So that impacts receptor binding profiles and many other aspects. And so these are all things to consider as we evaluate risk factors for interspecies transmission and viral evolution. And so staying along those lines, thinking about different routes of transmission, right? We could have, as I mentioned, the direct transmission and adaptation. You have that spillover event to a human, and the virus mutates, adapts in that human host to be able to potentially create onward transmission. We could have transmission be an intermediate host and adaptation within that host. That host allows for mutations to occur, and that mutated virus becomes then susceptible, or I should say a human then becomes susceptible to that mutated virus. And the third option is reassortment. So essentially what that is, and I should note that the idea here is from a mutation perspective. The mutations typically would occur potentially on surface proteins to evade pre-existing immunity, or to allow for that tropism change and for the virus to be able to bind and infect in a different type of species. Reassortment is essentially the combination and exchange of genetic material between two influenza viruses. Because it's segmented in nature, if two viruses infect the same cell, they can actually then exchange genes while they are replicating and then assembling. And so you can create a brand new virus through that reassortment process. Reassortment does not always result in a massive pandemic, but pandemics have resulted because of reassortment. It's a novel virus that has not been seen before. And so this idea of reassortment is essentially where we got both the 1957 H2N2 pandemic, the 1968 H3N2 pandemic, and the 2009 H1N1 pandemic. And these pandemic viruses don't go away, right? They essentially become more adapted to human hosts. We develop immunity. We develop measures to vaccinate and protect against them. And so they become more established seasonal strains, right? So the parental 1918 H1N1 virus was one of the backbone viruses that resulted from the 2009 H1N1 pandemic. And so there's some really interesting epi data about individuals who had been exposed to the 1918 actually had some, interestingly, some immunity to the 2009 virus. And so the impact in a particular elderly populations was not as intense as would have been projected because of that existing immunity. And as you can see here, some of the combinations essentially are a reassortment between two viruses, one human, one avian. But in 2009, it was actually multiple reassortment events, both from humans, avian, and swine population. So want to really address the topic at hand, which is this idea of spillover of H5N1 and high path H5N1. This is a picture actually from Michigan, where there were certain flyways where birds were typically sampled for regular surveillance. And when the team went to do the surveillance, the number of terns and gulls that had actually succumbed to infection was more than they could handle, and the surveillance response became more of a cleanup response, unfortunately. So the World Organization for Animal Health, previously known as OIE, has developed a methodology to look at seasonal trends and outbreaks. This is particularly looking again at avian influenza in animal species, predominantly avian species, right? Because this is the World Organization for Animal Health. So between 2005 and 2019, they collected reports from over 76 countries and territories about roughly 18,620 outbreaks in poultry. And what they found was that there was absolutely the seasonal pattern. And the methodologies that was actually published in 2018. Basically what they see is that we have massive spikes in outbreaks, particularly in the beginning of the calendar year. And it really peaks in February and then starts to get that downward trend in March. Also documenting that spread seems to be lowest in September, and then rises up again in October. So it's really something that has been captured over time as a seasonal pattern. The red rectangle there is just really to indicate where we are now. And if we want to be hopeful, we can say that we are in the downward trend of outbreaks being reported, and would assume or guesstimate that the current surge in H5N1 in avian hosts would decrease in the next few months. And I'll put kind of a imaginary asterisk on that comment, because we are still dealing with the 2021 outbreak of H5N1. It never really stopped. And so I think that's something to consider. This is WHO's data looking at the number of confirmed cases of human influenza, so spillover events from high-path H5N1 reported since 2003 all the way up to this year. And this is data that gets updated on a pretty regular basis. And so to date, there have been 868 cases with 457 deaths. So again, quite a high case fatality rate, about, I think it's 52% or so. And some years the case fatality rate is quite high. So for example, in 2005, case fatality rate, particularly there's a strain that was circulating in Indonesia, was in the 60 to 65% case fatality range. So very, very high case fatality range. Something fun to note is that the US had our first case of H5N1, human case of H5N1 this past year. And I'll talk a little bit about that in just a second. But you can see the range and the global range in where these viruses are popping up, particularly from a human case perspective, right? It's not centered in one particular region. So I thought it would be important to kind of revisit what happened last year. Really late in 2021 and then throughout 2022, H5N1 spread quite efficiently in the US, both in wild bird populations, in domestic poultry, and in that aspect, talking about both commercial and backyard farms, and then also was isolated to many surprised individuals in wild mammals. And this is just a schematic from USGS, really capturing that data through October of last year. The red dots indicate commercial poultry. The green are wild birds. The yellow are backyard flocks. And so you can see really the really nice pattern, right, of where the wild birds are migrating, the routes that they take, and then where commercial and backyard flocks are located. And the blue, the wild mammals, are kind of interspersed within that, primarily in the Michigan area, and a bit on the US-Canada border here. So in terms of outbreak progression from last year, there were cases that had been reported across Europe and the Middle East that really highlighted a risk of this spread through migratory birds. And there had been 62 wild bird species that had been infected with massive fatality rates. So these were reports that were coming through not just within the flu world, but really out there in the public media about this. And so the U.S. responded and began to increase surveillance efforts. There, the flyways are very well known. There are a number of teams, both academic and government, that do regular surveillance efforts. And so it was just really a matter of scaling that up. I will note that, in my opinion, the support that is available for that is never enough. While we did increase, and I think efforts in Canada were also in place for that, we weren't able to respond as much as I think people would have liked. In December of 21, there were a number of birds that actually died in a petting farm in Newfoundland, and they tested positive for high path H5. And then there were ducks that had been, so some of the surveillance efforts that are done in migratory birds is that there are agreements with hunters that the birds that they shoot can be sampled, and then we can determine whether or not those birds are infected with particularly priority diseases. And so that agreement is in place in a number of states. And there was a duck killed by a hunter in South Carolina that was carrying H5. And so it was clear that this was migrating south across the US and through those migratory pathways. In February, there had been Ohio and Mississippi River sites that had been positive. There were farms that were finally reporting, not finally, I should say, but were formally reporting infection. Typically in the US, when commercial poultry farms detect cases of influenza, if it's low path or high path, there are mechanisms in place to essentially cull the affected population, right? So you are looking at farms that have houses with tens of thousands of birds that are then being destroyed because of the risk factor for transmission and onward spread. The US has systems in place to subsidize those farmers when that happens. Not every country has that mechanism. And so the risk factors, when we think about how we respond to diseases, particularly in animals that have risk factors for spillover, the mechanism and the encouragement to support and report and respond can be very different depending on the resources available to those individuals, right, and to those farmers. Let's see what else here. So in response, essentially in this last year, there were millions of chickens and turkeys that were culled essentially to prevent onward spread and to prevent additional economic losses. The US experienced a pretty major H5N1 outbreak in 2014 and 2015 that really impacted a number of communities in the Midwest. It impacted poultry, meat and egg prices as well, and decimated some farms. This outbreak last year, the number of species that were reported to have been infected, both from a commercial perspective and from a wild species perspective, was 2 to 3 times the number from the 6 years prior. I think at one point, the case count was over 112 different wild aquatic birds or wild migratory birds had been tested positive for H5N1, and that was either through capture or testing off deceased birds. So when we look at H5 across the US, and this is data actually collected from the CDC, and this is capturing both backyard and commercial poultry. To date, the US has had over 58 million birds affected. And we look at from a state by state perspective, and I should note the map that's got the purple coloring, that's county by county. But in terms of states, 47 states affected, 401 counties that have been affected, and 805 individual outbreaks that have been reported. This is all here at home. When we look at how this virus spread and we compare it to previous outbreaks, for the outbreak that happened in 2014 and 2015, humans were actually to blame for the spread. So when we think about farm biosecurity, right, different than what we think about from, let's say, a laboratory perspective, but we think about the vectors that could assist with disease transmission. If we have the same truck that delivers feed to a number of farms, and that truck drives through mud and gravel that is near the poultry farm that has been infected, they can actually, those tires can carry the virus over among and between farms, right? If workers are going from house to house with the same boots and not disinfecting or changing their boots house to house, that's a very easy mechanism to spread. And so the 14-15 outbreak, that was really the major vector. For this ongoing outbreak, it's really the migratory birds and the wild birds that are the major vector for exposure, infection, and onward impacts to domestic poultry. So this is just another schematic on flyways, but this is very much focused obviously on North America. I tried to overlay the USGS map and it looked terrible, so I apologize. But essentially, if you did so, you'd see that a majority of the areas where we had major outbreaks line up perfectly with these flyways. Again, these are 4 different flyways in the US. They interact at times, both in Canada and certain parts in the States. So these birds are intermingling through their routes. So in terms of the first case of human H5N1 in the US, this was a case that was notified in April of last year. So just a little under a year ago. Anytime that a country has a novel case of influenza, that requires immediate notification to the World Health Organization. And that's through a mechanism called the International Health Regulations. Cases are also reported to the World Organization for Animal Health through essentially the Chief Veterinary Officer or the Ministry of Agriculture or Wildlife Services, based on the composition of the country, right? And so for humans, obviously, the report would go to WHO. And this was an individual who was actually assisting in a commercial poultry facility, looking at essentially culling poultry that had been impacted, or the farm that had been impacted, and developed some symptoms on the 20th of April. And the activities had taken place between the 18th and the 22nd of April. And this virus had been confirmed positive for H5N1. RT-PCR did confirm that that individual had been exposed and had H5 infection. And they also then followed up to confirm that it was an H5N1. So there are different diagnostic tools that you can run relatively quickly to be able to determine that. So just within a few days, the patient was isolated, was treated, was given antivirals. There are a few antivirals that are available to treat influenza. I would note that they have to be distributed and administered very quickly and very early on in infection. Essentially, the mechanisms that they use are to block either replication or to block release. So if you don't treat early on, you've already allowed the virus to replicate. And so you essentially have the treatment with an antiviral would be relatively ineffective. So being able to administer that early on in infection assisted, I think, with patient care. And luckily, this patient was not hospitalized, didn't have any severe manifestations, and had a full recovery. And there were no other cases that had been associated with this farm or any other farm in responding to the outbreak as of yet. So just want to take the next few slides to talk about what's going on now, and considerations for how, as a public health workforce, we think about planning, preparedness, and response as we are essentially exhausted and burnt out from 3 years of COVID and monkeypox and everything else, right? So when we look at the World Organization for Animal Health, WOA does situational reports on AI every 3 weeks. So this is the capture for February 17th to March 9th. In these 3 weeks, so this is not comprehensive, this is just for this 3-week period, there were 44 new outbreaks in 10 countries. And I apologize as the map is a little small here, but essentially what it's highlighting is that all of the outbreaks that have been reported were H5N1, and they have been reported, as you can see, in a number of regions. There were, in that 3-week period, over 2 million poultry that had either died from infection or were culled in response to infection. And then there were 161 outbreaks in non-poultry species, and that was reported in 19 countries. So if we think about non-poultry species, this could be sea mammals or land mammals that have been impacted by this particular virus. And this is just a second figure really showing the schematics about where the new outbreaks are. 32 across Europe, 11 in the Americas, 1 in Asia, and then the losses. Interestingly, right, the losses are not necessarily matching up with the new outbreaks in terms of either response to or as a result of infection. And that could really be dependent on where those outbreaks are occurring and the density of poultry in those environments. So going now to a purely domestic perspective, and this is information that USDA puts out on a regular basis. As of March 27th, so I think that was just 2 days ago, there have been 814 confirmed flocks that have been infected with high-path AI in the US. Again, 47 states that have been affected and roughly about 58.5 million birds that have been affected. This map up top is just within the last 30 days. Cases that have been reported and birds affected by state. So we can see based on the density or the strength of the color green where the highest hit areas are. So interestingly, Pennsylvania right now in the last 30 days is one of the hardest hit states. And then the graph at the bottom is really just showing states that have had detection in wild birds. So comparing the domesticated poultry farms, backyard flocks to wild bird populations, essentially every state has isolated high-path AI in a wild bird, either through surveillance efforts or based on sampling dead birds. This is what I think is getting everyone concerned, and this is the detection in mammals. This is just a schematic looking at the US, obviously, and this could be done from a global perspective, but just looking at where are cases being reported and in what kind of species. It's not the same type, and so that's a little concerning. There have been massive die-offs of marine mammals, both in Europe, on the coast of South America, and concerns about, in particular, an outbreak in a mink farm where there is still discussion and research being done as to whether or not there might have actually been transmission within that mink colony. And if that were the case, that could be a concern, thinking about, did that virus adapt in that mink host that allowed for that onward transmission within that particular species, again, in a very densely populated environment. And so this detection of mammals, I think, is something that we can't ignore. It's something that needs to be addressed and researched and considered as we look at the ability to analyze sequences very quickly and very efficiently to determine if this virus is adapting in any way that might be of concern from a mammalian host perspective. And then there's also consideration of, how are these animals infected? Were they hunting and essentially scavenged a dead bird that was infected, or are they getting exposed in different routes? And so that's something else that many people are looking into, but something that has historically not been to the scale that we are experiencing this year. And as I mentioned earlier, a few slides back, essentially the 2021 outbreak never really stopped. And what we found, what the literature is discovering, is that scavenging birds really played a role in being able to carry this virus through what would have been more of a seasonal pattern with migration. And so while typically from an avian influenza perspective, you get that seasonality and you almost get like a break and a rest, as it were, for risk factors for onward adaptation. That really was not the case. And so we've really been experiencing this essentially 1.5 year long outbreak of high-path AI in avian species, and now spilling over to mammals. So in terms of response, when we think about like how worried we should be, again, I do think that right now what is important is to think about how best to respond for avian species, how best to contain onward spread in avian hosts, how to protect poultry farms and commercial flocks, both home and abroad, and then really to make sure that we are paying attention and conducting the proper research to determine when we have these cases in mammalian hosts, whether they're marine or land, that we understand the mechanism for infection, and really looking at the molecular level about what that could mean for potentially sustained transmission and or risk factors for human spillover. But wanting to just kind of wrap this up, hopefully with a bow of some kind, is thinking about public health capacity, right? So when we think about COVID and we think about everything that we dealt with for COVID, we are continuing to deal with COVID and everything else that we've had to handle from a public health perspective in the last 3 years. Thinking about a surge response to another pandemic that may end up becoming something that, if it is flu or not, we know the next pandemic is happening at some point, right? We don't know when, we don't know what it is, but we know that there will be something. When we look at the impact of the healthcare workforce, over 180,000 healthcare workers lost their lives during the pandemic. There's been an unprecedented attrition, right, of both national, state, local level public health officials and epidemiologists. There are estimates, and again, this is a combination of a couple different reports, that between 1 in 5, at least 1 in 5 health workers have left the field, and about 31% intend to leave the workforce within the next 2 to 3 years because of burnout, because of exhaustion, and for a number of other reasons. So while flu may not be the next pandemic, and if we're lucky, H5 is not a major risk factor for mammalian spillover, there's still the consideration of how do we revise our risk calculus, and how do we prepare for a public health workforce that can respond. And I'll just throw it in here because I try to look at everything from a One Health perspective. How do we build those links between both wildlife and veterinary services as well, to think about communicating risk factors when we see outbreaks in animal hosts? We know that a majority of emerging infectious diseases are zoonotic in nature. And so how do we, both as a US-based workforce and as a global workforce, think about better connections to be able to really consider and prepare for these risk factors moving forward. So I'll stop there. I'm sure you're all ready for me to stop talking, and happy to take any comments, questions, or concerns. And thank you guys so much for your time and your attention.
Thank you so much. Yeah, thank you so much. And firstly, we will, if there's some question for the happy student, and then if there's some question about a happy student, and yeah, if you have some questions, you can raise your hand or just tap. Yeah. Yes, actually, I have one question that I would like to ask, and the Dr. Sorrell, and is there have some vaccines or the antiviral medication used to prevention and treatment for the avian influenza, and how to challenge it and are faced in their development and distribution?
So a great question. So right now, it appears that the antivirals, again, if given early on in infection, can help treat human infections, particularly for high-path H5N1. They do have to be treated within essentially 48 hours of exposure and infection to really be the most effective. We have a stockpile of human vaccine for H5N1 that's based on the avian strain that was developed a few years back. So the conversation that is one that I think is being had and should be had is, will that be the strain that becomes, if we were to face a spillover and an established infection and, onward spread and leading to a pandemic of a novel H5N1, does that wild type, essentially, does that avian backbone protect us? Is that similar enough to the strain that becomes the circulating strain, right? Because we know that there needs to be some adaptation. There needs to be some mutation, potentially reassortment, right? That would lead to that pandemic. And so there's, I think, pros and cons to stockpiling a vaccine against what was essentially the parental virus. There is always going to be some level of protection from that. And so that's good. So better be prepared than nothing. But the question really becomes, how much of protection will that provide? From an avian perspective, poultry production particularly, there are a number of countries that actually approve vaccinations and provide vaccinations to commercial flocks. The US is not one of them. And there is discussion, and I believe the Biden administration is right now discussing what that would mean for first of all, a rollout, what it would look like in terms of timeline and how that could be developed and received. But I think that's still very much in the discussion planning conversation.
Okay, thank you so much. And yeah. And actually, I also have another question that I want to know, because as we know that in the beginning of this year, we are facing some the price rising and very high, as we know, is kind of due to some the avian flu right now. And is there have the current recommendation for the prevention and control for this for the chicken for the poultry industry to reduce the risk of avian flu the transmission? Yeah.
I will say that I am not as well read into what the, let's say, commercial poultry industry is doing in terms of mitigation. I would note though that once the virus has been detected in a farm, whether that farm is 5 chickens or 45,000 chickens, that farm is pegged as infected, and those animals are culled. And so the fact that we have both broilers and layers, so we have chickens that are produced for meat, and then chickens that are essentially, producing eggs for market and consumption. Both of those are getting impacted, and so the demand is greater than the supply. So I think implementing stronger biosecurity within farms, and also thinking about risk factors for environmental exposure based on migratory routes is critical in preventing as much exposure as possible.
Gotcha. Thank you. And yeah, and then we will turn to the unhappy student. And oh yeah, Anna has some question. Yeah.
Hi, yeah, I was just wondering, because I'm very interested in what you've discussed, and also as public health officials, I was just wondering what you think some tools that advocates we could use to fight off some of the misinformation, and even these issues, health issues can often get politicized as we found the pandemic. So what tools you have seen that work as advocate in order to deliver the information in a way that people can understand and serve as a preventative mechanism through vaccination or other methods?
Yeah, Anna, that's a really good question and a tough one, and probably could be the next 5 seminars for this class, right? I think one of the challenges is from a risk communication perspective. Silence means a lot of different things to a lot of different people. So when you don't share information, even if it's limited in scope early on, people start assuming, right? Because the information hasn't been shared. So I think one of the tenets of RISCOM is be first and be clear. It is okay to say that this is the information that we have at hand, and that there is more that's being collected, and gaining the trust of the public and or practitioners to do that. The politicization of health is a serious challenge that I think got exacerbated in COVID and isn't going away. And so it's something we're going to have to deal with regardless of the pathogen at this point. And so I think it's involving many different players to make sure that the messages are clear, concise, and consistent, whether you are a public health professional, whether you are a policy analyst versus an economist, that there's a cohesive message, right, about the impacts of a particular pathogen. And I think making sure that there's better training and education and resources for basic scientists on how to communicate results, and how to make it consumable to the public, I think is critical. But I will caveat, I am not an expert on mis and disinformation, but I think it is a very serious issue that we're going to have to deal with, really, sadly, moving forward.
Thank you. And yeah, and we will turn to the unhappy student. And if guys, you have some questions, you can just to raise your hand and unmute and.
Let me interject a question while our happy students get their brains working. So this might sound kind of silly, Dr. Sorrell, but I'm thinking about, just personal experience, things that I see, which is what everybody does, right? And what I see is that raising a poultry is becoming like a widespread hobby in this country, or backyard agriculture. And thinking about this, so at first you're talking about small numbers of animals and you're not exchanging animals, but then on the other hand, people are shipping containers of chicks through the mail, right? And there's like depots at shipping facilities where they put all those boxes together and such. So are you familiar with any efforts to kind of assess like what the downside of that kind of thing is? And then, at the same time, in my daily or regular activities, sometimes I see these huge chicken trucks like driving down the street with must be thousands of chickens on a truck, right, with open cages and such. And you're not on a veterinary side, I understand that, but how much are people thinking about, our kind of how we run our businesses and how we run our hobbies too?
Yeah, I think there's a lot to unpack there, right? From the kind of interest in backyard flocks and raising chickens, either for eggs or for meat, and what that means when you're essentially a small backyard farmer, right? And thinking about the risk factors for your chickens, AI or not, when you put them in an open environment, right? Particularly in potentially more of a suburban open environment, and what that means. And I think that's something that the USDA and APHIS have some educational and informational material on. I think there are some really good networks and communities to look at poultry health from that perspective. For transportation, I think there are always concerns about what it means for feathers and foam mites kind of flying through the highway, right? But lucky for us, I would say, from an H5 perspective, the risk factors there are not as great, and the infection and incubation period is quite short, and so typically you would not have a chicken exposed that would actually be able to be brought to market and or to a processing facility, because it's such a severe infection right now. So while it is a risk factor, I think it's not the at the top. But I will also caveat that I am not privy to analysis on how best, from both a environmental and enrichment perspective, right, and animal welfare perspective, how best to transport poultry. So I will stop that comment there. And then from a global perspective, poultry meat is cheap, right? From a perspective of you are developing countries that are getting better access to protein sources. Your communities are advancing in their livelihoods and now being able to actually, buy more protein on a weekly basis. Chickens are a lot easier to raise than cows or sheep or goats or swine. And so I think the growth of the poultry industry from a commercial perspective globally has really intensified in the last few years. And that just expands risk factors because of potentially location, risk factors for exposure, not considering biosafety perspectives or environmental perspectives and where you put that commercial farm. So I think there are a number of things to consider from that backyard flock in the US and kind of the lifestyle choices versus market-driven perspectives of demands for protein and accessibility of raising poultry.
Yeah, thank you. And also we said Brenna have some question. Yeah.
Hi, yeah, thank you so much for the seminar today. So I was wondering, because I was thinking back to like 2008, 2009 with H1N1 and how the public perception at times made it kind of seemed like, oh, it's just like a cold. When you get it, it's not a big deal. And I remember that being kind of the predominant message for a really long time. So I was wondering, what is the public's perception of H5? Is it similar to that? Do you think that people think it's overblown? Are people aware of the risk? Because obviously, as people in public health, like we tend to know about these things a little bit more. So I always want to ask, like, in your experience, what has some of the public commentary been, and even like personal reception to this?
Yeah, thank you for that question. I think one of the challenges with the 2009 pandemic, well, pros, I think it's actually a big pro, but one of the challenges from a risk communication perspective and a response perspective is that where the virus was detected, where the virus originated, was in an area where you had regional collaboration on surveillance and lab capacity. So you had viruses that were getting isolated in California, across Mexico, and even networks in Canada. So the US, Canada, Mexico, essentially collaborating on sharing reporting, sharing data, sharing sequencing information, and essentially developing this trilateral network to figure out, is this a novel strain and how worried should we be? If that virus had been isolated in another region of the globe that did not have that capacity, that bandwidth, have the resources for surveillance, for laboratory capacity and detection, for sequencing, we may not have caught it as early as we did. So there would have been a lot more cases that occurred before we even knew about it. That wouldn't necessarily have impacted the case fatality rate, right? That doesn't add up, but we were able to respond quickly because we were able to detect and characterize quickly. So I think a lot of times you are almost dinged for having capacity, right? One of the challenges is if you're really good at surveillance, you have nothing to report because you've captured something before it becomes an issue. And how do you write a report on that, right? How do you show a graph on that? We did our job and now there's no outbreak because we were able to respond and contain. When you don't have that capacity, or it's limited, or it's redirected to something else, i.e. COVID, and during a pandemic, you've got all these other endemic diseases that are having issues with detection response capabilities, that can be an issue. And so I think because it was not as aggressive as it could have been had it been isolated somewhere else, there was a unfortunate misrepresentation of the actual positive results of a combined surveillance and detection capacity there. For this outbreak, I think we have to be very careful about messaging, because right now the risk is not a novel pandemic strain. The risk right now is that this virus is killing a number of bird species that typically would not have been impacted at this severe level. We have major impacts if we think about the ecology of wild bird populations, of migration routes. We have species that have had massive die-offs, and we don't know what that's going to mean for future generations of that species and the impact of the migration in that environment, right? And I have absolutely no background on that, but something that I think is a major concern. And then we have the concern about this virus being isolated in a number of mammalian hosts, right? Non-human mammalian hosts. And what that means in terms of, are we giving the virus an opportunity to expand its host range and potentially to mutate in those expanded hosts? That's where I think the effort should be focused, is to get in front of it then, to figure out, is this virus mutating, and then have the conversation about whether this could be of concern, not jump right into, we have a pandemic on our hands. So really just making sure that we're focusing on the issues at hand so that we can be proactive and not reactive.
Thank you so much.
Thank you. And yeah. And right now, if someone has some question, you can just raise your hand or tap to the comment board. Yeah.
I see a question in the chat about how culled animals are disposed of. So it it depends on the method of culling. In the US, there's a pretty effective and humane way of culling, where the animals will be essentially disinfected, and so they can be buried. In other countries, they are put into burn pits and disposed of that way. So again, depending on resources and policies and procedures, it can be varied.
Thank you. And yeah.
I have a question.
Yeah. Oh, yeah.
Thank you so much, doctor. Thank you so much. I am a reporter myself, and I'm just astounded at how little coverage there is of this. As you noted, this is not new. This has gone on for several years. We're now talking about 58 million birds killed in the US and 360 million killed worldwide. And yet all we might hear from media is egg prices are going up. So can you address that, please? Thank you.
Sure, no, happy to. Yeah, I think that there is a disconnect with why egg prices have gone up and what that means. And again, not to sound like a broken record, but I think what is important is to really assess the risk and balance the risk. Right now, the massive risk is on the avian species, and that it is time for us to start thinking about what this could mean for potential spillover, right? We've seen cases pop up. And so instead of waiting for clusters of cases, let's really look at and get our hands on an understanding of what the virus is doing in mammalian hosts. And I think that there is a lot of research underway on that. And so it will be important for that to be shared. And that will be important for that to be communicated so that systems can adapt based on the outcome. In the meantime, there should absolutely be conversations about what mechanisms are in place at the local, national, global level for response, particularly as we are still recovering from, and in some cases still battling, the COVID pandemic, in addition to a number of other public health priorities when you think about it from a global perspective. So it is time to plan and prepare and consider, and those plans and preparations can be agnostic, right? They can discuss AI, avian influenza, but that plan or that preparedness mechanism really should be in response to the next threat post-COVID.
Thank you. And yeah, we see that thing. Have some question? Yeah, you can just unmute you.
Hi, can you hear me?
Yes.
Okay, so this is T. I'm from Myanmar. I'm currently studying global health and health security at the Taipei Medical University. And my research interest is around pandemic preparedness and response. So my question to you is there any ongoing research collaboration between your organization and this part of the world, like in Asia and in Southeast Asia or Pacific country? And is there any opportunity in the future? And we would like to collaborate with you on the pandemic preparedness and response. Thank you.
Thank you. Yes, I would say that there are a number of fantastic collaborations, both from a regional perspective and a global perspective. Influenza is a pathogen that I think has gotten a lot of support from the international community in terms of investments in surveillance systems, in preparedness and response planning compared to other pathogens, because it is both a seasonal epidemic and a potential pandemic threat. And so depending on the type of collaboration you'd be interested in, I think there's a number of groups that could be of interest. And I will make sure that you have my email, and I'm happy to think about how best to connect you, either from a basic research perspective or from a policy and preparedness planning perspective.
Thank you. In our program, we are studying about the International Health Regulation 2000 IHR 2005. And also now we are looking at the new pandemic treaty. And we are very interested in how this avian influenza and then this vice versa, this new pandemic treaty and the funding pandemic fund can impact on this new pandemic. Thank you.
Thank you.
Thank you. And and there have some question from chatbot, and there are children in need of particular education rate H5, and are they particularly susceptible for the infection death threat from the John?
So I would say that for any influenza virus, most influenza viruses, I should say, you have that typical U curve, right, where the youngest and the oldest are most susceptible and have the greatest severity in infection. The only time from a pandemic perspective that was different was in 1918, where it was actually almost like a W, where the population that was severely impacted, particularly from a case fatality rate, was young adults between 18 and 24 years of age. And that had a lot to do with the time period in which the outbreak occurred, what was happening in the globe in terms of World War I, the movement of troops and all of that. So, and because of essentially a cytokine storm that healthy adults responded to with infection, that ended up becoming a major negative response in their outcomes. In terms of education from an H5 perspective for kids, I think it's really right now a focus on just general hygiene and best practices, particularly for kids who have more exposure to environments where they would be interacting with poultry, both domestic and wildlife, right? If you're living near certain bodies of water, if you by chance live near or on a farm, that type of educational material would be, I think, really helpful for just general awareness for children. But from a more generic perspective, I think right now it's the general hygiene that really would help them out with a number of different common pathogens.
Okay, thank you.
Hi, I have another quick question, Dr. Sorrell. So the rapidity of the vaccine response to COVID was really astounding, I think, to a lot of people. And I'm wondering, does that transfer over to influenza vaccines, do you think, or to change how we might approach a virulent strain of influenza in the future?
Yes. So I would say that the vaccine uptake in 2009 was not as great as I think people had hoped or had considered and planned for. Part of that was delays in just producing the vaccine, and the understanding that it wasn't as virulent as some may have thought. And so I think people kind of had an internal risk assessment and said that was not something they wanted to take. In terms of vaccine uptake in the event of a novel flu pandemic, I think it will very much depend on what it looks like in a human host, sadly. How virulent it is, how quickly it transmits, and how effective the vaccine is. We had exceptionally effective COVID vaccines that were not, I think, as accepted as we would have thought from a general perspective in the US. We also had countries that were waiting in line for vaccines. And so I think, not to get into a total different conversation of vaccine equity, but there needs to be lessons learned from COVID about how to produce a vaccine in a reasonable time frame, and have it accessible to particularly high risk populations and not to the highest bidder. But that's my personal opinion on that one.
Thank you. So we have a couple of minutes for a last question, or perhaps two, if anyone has them. Raise your hand or just speak up at this point. Okay, not seeing any, and if you have one, just jump in. But I want to thank Ebo for moderating today and doing a good job of introducing Dr. Sorrell. And Dr. Sorrell, thank you for your repeated appearances with this group. And I hope that now that you're over with the Hopkins public health folks, that we can still count on you to come back every once in a while. It's very informative to hear your take on these things. I also want to thank the audience. We had a good international representation today. Our first person from Myanmar and some of the other folks from Canada, etc. So thanks to everyone. And we have 4 great seminars coming up in the next 4 weeks. So we'll see you again.
Wonderful. Well, thank you all for the opportunity, and